Nick Darr here with Big Z Media. Hope you enjoy the episodes of Business Over Brew, and pleased to have the Riverbend Growth Association as the sponsor of this program. Our missions are kind of the same. Really, we're attempting to educate people about business, foster business in the Riverbend community. The Big Z has been a member of the Growth Association forever, probably back to our inception as a company almost. We have always been members of the Growth Association, have gotten a lot of benefits from it. There's so many networking opportunities you can take advantage of. I've met so many great people just because I've been a member of the Growth Association and taken advantage of all the events that they have, plus just some of the resources they provide you, the relationships you build, just lots of great reasons to join the Growth Association. They do a lot of great things in the community as well. They highlight a different nonprofit every month. So really, they're just invested in the community here, and especially the small business community, which is what Business Over Brew is really all about, which is helping the small business community, because it's so important to any community to have a thriving business community, and the Growth Association has really helped with that. If you want more information about joining or events that might be coming up, they have events all the time that you should definitely take advantage of. I'm going to give you the website to go to. Just head to growthassociation.com. You can get a membership directory. You can see who's taking advantage of it. You can see about the events that are there, learn more about possibly becoming a member. Or if you already are a member, you can find out what's going on with the Growth Association at growthassociation.com. So just again, big thank you to the Riverbend Growth Association for sponsoring Business Over Brew. Welcome to Business Over Brew, sponsored by the Riverbend Growth Association. We certainly thank them for their sponsorship. I'm your host, Nick Darr, pleased to be joining you as always from inside the Great Rivers Tap and Grill at the Best Western Premier Hotel, one of Alton's really hidden gems in terms of a great restaurant. If you haven't checked it out yet, it's definitely worth your time to do so. And this is a show where we talk business with some of the Riverbend's most interesting and influential business leaders, and we've got one of those today. Jerry Rumph, president of OSF St. Anthony's Healthcare. Jerry, thanks for coming on the show. Appreciate it.
Yeah. Good to see you.
I guess let's just start here. How does one get to become a president of a hospital like OSF St. Anthony's?
Yeah, it's really based on experience, right? And there is there's requirements as far as education as well. So for me, I actually was in the military. So I was in the Army for 20 years, and when I was an officer, so when I joined the Army, I did medical logistics. So did that for about 10 years.
Right.
And then the Army sent me off to Baylor University in Texas to get my master's in healthcare administration. So that's one of the requirements really to be a hospital administrator, is to have an advanced degree in business administration, healthcare administration, or something of that nature. So then I spent the second half of my Army career, 10 years, doing hospital administration. So Army hospitals are no different than civilian hospitals.
Mm-hmm.
We have to be accredited by the Joint Commission, just like we have to here at St. Anthony's. We see patients, no different, we just wear a different uniform. So after 20 years, my last duty assignment was at Fort Leonard Wood in Missouri, and so we retired to St. Louis. And then I spent 13 years working for SSM Health
Mm-hmm.
there in St. Louis, kind of working in various roles within that organization. And that's where you get that experience. So you're working, you're kind of your way up, getting the experience in hospital operations, strategic planning, finance,
Mm-hmm.
the core competencies you need to be a president of a hospital, to run a team and kind of lead it, to the next generation.
Right. My wife and I are very different people. She knew what she wanted to do from like second grade on. She wanted to be a school teacher. And my path was a little bit different areas, kind of tried some different things. For you, what was the path like for you? Did you always know you were going to go in the military? Had that always been something, a thought of your mind, or how did that decision come about?
Not really. I mean, what I wanted to do was actually wanted to be a pediatrician. That was my desire, was
Mm-hmm.
to go to medical school, be a doctor, pediatrician. When I got to college, I got into the pre-med program, and that's when I started exploring ROTC as an option, primarily for scholarship. But then after I got into the program, I just loved it. I
Mm-hmm.
really loved everything about it, the camaraderie
Right.
of the military. So when I graduated, I either needed to be accepted to a medical school at that point, or I needed to go on active duty. So since I wasn't accepted to medical school at that point, I went on active duty. So I did my first duty assignment was with the infantry and was out in the field and hua hua, all that.
Right.
But then when I got back and I had to go to this advanced course, while I was there, I studied for my MCATs and took those and started getting applications from all these medical schools. And my wife and I already had 2 kids by that point. And so her comment to me was, by the time you finish medical school and residency, your boys are going to be this big, and you're going to miss all that.
Right.
So I decided to go into healthcare administration and do the Baylor program that I mentioned. So the Army accepted my application, and I went off to Baylor to get healthcare administration. So I think the fact that I had an interest in healthcare, studied biology and chemistry undergrad, actually makes it a lot easier as an administrator to understand all the things that are happening, the aspects of these complex cases, working with different physicians, to be able to talk about organ systems and human function from a biological perspective gives me a little bit more credibility.
Right.
Than if I was an administrator and say, I don't know anything about that.
Right.
Yeah.
I wonder, outside looking in, if it's like, in some professions, it's like, well, he's not a doctor. What does he know? Is there a little bit of that in your profession of in charge of the hospital, but not a doctor? I don't know if there's any of that in your profession or not. I assume there might be.
Yeah. Especially with the physicians.
Right.
So, physicians don't like to be told what to do or how to do it. But we got to work together, especially in this new environment of where insurance companies want to pay you less than what you need to operate, and we have to be more efficient, and the physicians have to be a part of that. And then they say, what do you know about healthcare? Right. So having some credibility and being able to talk and know what you're talking about, and not just being a pure administrator, because they call those administrators bean counters, and all you're looking for is profit, instead of looking at the holistic piece of how do we provide health and resources to our community, but at the same time being able to stay open, because without margin you don't have a mission, right?
Right. Yeah. It maybe is a little bit some similarities to being in the military. Our last few commanders in chief have not come from the military. There's probably a little bit of that in the military too.
Oh yeah.
Well, what does he know about running a
military?
Right.
Yeah.
So I bet there's a little similarity there.
Oh yeah. When I was in the military, there was always, they never served in the military, so how do they know?
Yes.
But I think a good commander in chief who doesn't have military experience, just like a hospital president, really has to be open to their right hand men and women that give them that information and say, here's our recommendation, and be open to taking recommendations of those who know best.
Right.
So for me, I get to surround myself with those, like Dr. Sands is our chief medical officer, Lisa Shepherds is our chief nursing officer, and they've got the background and experience, and I really rely on them to help me. So we're a triad of leadership that runs that organization.
Right. You mentioned leadership, and really this podcast is kind of it's about business, but it's about leadership too, because any business owner is leading something or someone, whether it's employees or customers, and you probably lead more people than anybody who's been on the program. Talk about a couple aspects of that. One, what do you take from the military on a day-to-day basis after spending 20 years in the military that still helps you today in the day-to-day operations?
Yeah, I like to say that I graduated from the premier school of leadership, which was the military. A lot of people, when I first started after my career, I had to kind of battle that you were military, so there was a perception that military is all about dictating and powering down, and you do what I tell you to do and jump. But I think it's more than that, because as a leader, what we learned in the military is if you lead troops in the middle of a battle, so there's bullets flying everywhere, as a leader, you need to be out front, you need to lead from the front, and you need to be able to turn around and see your troops behind you
Mm-hmm.
instead of them leave you
Right.
behind. So you have to have that trust. You have to build trust. You have to build camaraderie with your team, and they have to be able to see your vision and to see that you have the perspective of the greater good for the organization, and it's not about me, right? So I'm not here to build my resume. I'm not here to take all the credit. I'm not here to take all the glory. It's really about building my leaders into confident men and women that are the next generation.
Right.
So I mentor young healthcare administrators. So I have 2 mentorees right now that are in various levels of their career, not here in Alton, but now actually across the country.
Right.
But I think we have a responsibility to teach and educate young leaders, because I ask them, the first question I ask the leaders that I mentor is, what do you want to do when you grow up? And they look at me funny. But
Right.
and I tell them, do you want my chair? Do you want to be the CEO or the president? Do you want to be here? And if you do, I want to help you get here, because I need a successor, and we need successors who are competent in healthcare to continue this journey of providing healthcare to our community.
Right. And you mentioned the leadership, and not exactly. People think of the military as do it this way,
Right.
and I think it was Patton. It could have been Eisenhower that said, "Don't tell people how to do things. Tell them what you want done, and let them figure it out."
Right.
And that's really more of a. And if it was Patton, people think of him as like quite a dictatorial leader. So there's something to that of just hiring people and empowering them to do their job well.
Right. Yeah, because I think the best part of the work I've done on my career is jumping in to projects and creating solutions, implementing them, and then seeing them succeed. So when you do a lot of your learning by doing, so instead of be giving a checklist and told what to do and how to do it, and I just go around the checklist, it doesn't create that competency of thought process, research, innovation that you need to be a true leader.
But there are some definite differences too. I coached football at youth level, and I always say, well, if you could talk to people sometimes the way you do on a football field, just because there's urgency, and sometimes you don't have time to sugarcoat it, and the message just gets out sometimes in a real raw way.
Right.
And I would imagine it's that way in the military too, but it can't always, and probably a lot of times can't be that way in the business world. There does have to be a little bit more nuance and subtlety to how you present an idea.
Well, but sometimes there's urgency in healthcare, right? So if we have an issue where we see an increase in infection or C. diff or something in the hospital, there is that sense of urgency. So there is a point in which we have to say, here are the guidelines and best practices in the industry. We need to follow this recipe. And so there is a portion in which we are giving this template to leaders and mission partners in our organization, saying this is how we want it done, right? Because it's proven to be most effective industry-wide, right? But I think it starts with the why. So if you were in my organization, every mission partner can tell you what it means when I say, what is your why? So we talk about this all the time. So your why do you do what you do? Why did you choose healthcare? Why did you choose the specialty you're in? And then why did you choose a non-for-profit Catholic hospital to work in, right?
Right.
So that those 3 components together is your why. And it's the direction, it's the motivation, and it's also what I tell our mission partners, it's what you lean on when things get tough. When you're stressed and we've got, patients coming out of the woodwork, you have to always sit back and remember why you're doing this, right? Sometimes you question that. But if you have a good foundation of the work you do and the importance of the work you do, and like those checklists, these are proven, we do go down and explain the why so that they have an understanding of why we're asking them to do the things that need to get done.
Is there an answer you've received to that question that really stands out to you?
A lot of mission partners on the why, most of them will say, they really are driven towards doing good for the community. So they're reaching that level. If you study psychology, Maslow has a hierarchy of needs. So the self-actualization at the top is reaching that where it's not about me, it's about the greater good for the organization or greater good for the community or greater good for the patient. And nurses and doctors are really always there. You know, they're up there doing that work because they see it as a mission and not necessarily as a paycheck.
Right.
And that's really the distinction. When you got people in your organization that are there because they're just collecting a paycheck, it really makes it hard to achieve some of these benchmarks that you have to achieve in healthcare.
I think people would maybe be surprised by how many people work for your organization that are not doctors or nurses. What percentage are actually fall into that category?
So we do have a lot of nurses, you know, in our organizations. I would say it's probably about 65-35.
Sure.
So there are a lot of non-nurses, non-physicians that provide care. So there's a lot of different professions and professionals in the organization. When I talk to mission partners, we talk about everybody has a role. So we don't really call them housekeepers, right? They're environmental service.
Right.
But a housekeeper or environmental service technician, when I talk to them, I say, what is your job? So it's not to pull trash and mop floors. They're infection preventionists. They prevent infections.
Right.
And that's how we talk to them is, you know, your role in the organization is not just to clean and pull trash. It's really to keep infections out of the organization. So everything they do, all the cleaning surfaces, terminal cleaning patient rooms, terminal cleaning an OR. Imagine scrubbing everything down the OR between cases.
Right.
All the work they do is hard work, but it's for a reason.
And I think for a lot of us, that became even more of an issue during the COVID pandemic, but probably for you guys, it's been something that has always been something that was a serious issue.
Right.
Talk a little bit about just some of the most rewarding aspects of your career and maybe some of the things you're proudest of accomplishment-wise since you've been president.
Yeah. So I think what's rewarding is seeing others rise to the occasion. You know, so to your point earlier, it's really giving them the task and saying, here's the end state, here's the goal. Let's work on an innovative solution. So what I tell my leaders is I am there to remove barriers and provide resource, and then I need them to come to the table with solutions. Now we'll test them, right? So we'll test the solutions to make sure it's achieving what we need it to achieve. But I think when you start to see the end results of that, that is really what is rewarding. I'll give you some for instances. So we are working on a partnership with SSM. So that was when I first arrived here 2.5 years ago, that was the first thing they gave me. They said, we're working on, we had a conversation with SSM. We want to partner with them strategically and bring more of their resources into our market. So we have specialists in our market instead of sending patients all the way to St. Louis for that specialty work. So here you go.
Right. Yeah.
So as we start working on that, one of the projects we did was this project we call Telestroke. So at DePaul, they have a stroke program that's a comprehensive stroke program. So there's only 3 in the market. So Big Barnes, Mercy, and then DePaul. So the comprehensive stroke program, they have to achieve certain performance levels to be considered comprehensive. So they do it all. So there they have a team of neurointerventionists that will, if you have a stroke and if you have a blood clot stroke, so you throw a blood clot and it's clogging an artery in your brain, it stops the flow in that part of the brain, you have a stroke, right? So they have technology at DePaul where they can go in and pull that blood clot out, and then blood flows and your stroke is prevented from having long-term consequences on brain damage.
Sure.
Or if they need to do intra-arterial TPA where they can't retrieve that clot, but they can put clot-busting agent up to it and dissolve it. Or if you're having an aneurysm, they can coil the aneurysm to prevent that from bursting and then bleeding in your brain. So that's intervention work that's done at DePaul, at Barnes, and at Mercy. So we put in a program at our ER where patients come in, and if they meet that criteria, it's not a brain bleed, it's a blood clot or an aneurysm that needs to be taken care of. We have a telemedicine system, right? So we call it Teledocs. It's a computer screen where we get on a call with the neurointerventionist at DePaul.
Right.
He assesses the patient, he accepts the patient, and we ship them. We had a 45-year-old female that came in, and she was having a blood clot stroke in her basilar artery, which is right at your brainstem. And her NIH scale, so that's the National Institute of Health scale for stroke, of 8. I think that's on a scale of 1 to 10. So pretty severe.
Right.
We shipped her to DePaul. They did the clot retrieval, and she walked out of the interventional suite with an NIH scale of 0.
Wow.
So she has no deficit from her stroke. And that to me is rewarding because
Absolutely.
we put the process together. We've got a process to, really do that early detection, connectiveness with a comprehensive stroke program, get patients accepted into the hospital at DePaul quickly because time matters when it comes to stroke, and then to be able to have positive outcomes.
I know another area where you guys have really dove in is in the drug abuse and recovery area. Talk a little bit about some of your efforts there.
Yeah. So we started a medical stabilization program, and we refer to it as medical stabilization because it's a long word instead of detox, because
Right.
detox has kind of a negative connotation,
Sure.
and we really want to eliminate stigma when it comes to substance abuse because everybody needs help, and we don't want any more barriers to that. We're working with a company that does this nationally. Special Care Management is the name of the company. So we have been sourcing patients for our medical stabilization program since April. And when we did the business case and the pro forma and how many we thought we would get each month as the program grows, we've already exceeded the mature program like by double.
Right.
So we have about double the number of patients we anticipated that would be coming in this program. And it's been hugely successful. And patients want to come. What is more important is not just that we're stabilizing them from their addiction, detoxing off their addiction, and having
Right.
going through the withdrawal pieces of that. It's as soon as they're discharged, either that day or the next day, we got them into a program. So either into an inpatient program, an outpatient program, into some place where they're going to get further care.
Right.
And so about 82% of all of our patients are making it into a program same day or next day.
Yeah.
And that's the next piece. If we can get them into a program, the goal is for them to continue their program and stay clean.
A lot of people don't realize how much big of an issue that is
Right.
in terms of what's the next step after.
Well, it's finding them.
Yeah.
So for them to do it on their own would be almost near to impossible.
Right.
So for us to be able to source those aftercare programs, those substance abuse programs, whether they need to go to a 30-day inpatient or to a 30-day outpatient or go into some other program, we're finding them and sourcing that for them, and we're connecting them, and then we're getting them to those programs. And that's huge because that, I think, will improve the success rate of that program tremendously. We're not just there to stabilize them and then say, good luck.
Sure.
We want to stabilize them and make sure that they get a fair shake on getting something done and actually maybe doing something with their life.
Well, anything you can do, obviously, in that area is very impactful.
Right.
One of the biggest issue I think all communities are facing right now is substance abuse. So.
Right.
You're coming out, or we're coming out of maybe for everybody one of the most challenging periods that most of us have been through. A little, on the tail end of it. Hopefully, it's in the rear view. What challenges do you see on the horizon? What are things that concern you for the future?
Yeah. So the challenges that we're facing, I think, as a healthcare industry, is a big part of the patients that come to see, not just us, but any hospital system, is government programs, Medicare, Medicaid, the managed Medicare programs. So we're seeing the largest number of our population moving into over 65 than this history has ever seen. So we have a lot of patients that are moving into managed care programs or into traditional Medicare. And what CMS has been doing is really looking for opportunities to save money globally. So Congress is putting pressure on all of the departments. And it doesn't matter who's in the White House and who controls Congress.
Right.
They always fight with each other about the budget, right?
Mm-hmm.
So every agency has the pressure to try to reduce their expense. So for CMS, it's really paying out payments, right, to hospitals and health systems that do the care.
Mm-hmm.
So what we're finding is increased denials, which then that does to us is then it forces us to do the extra work of refiling, doing an appeal. They make us go to what's called a peer-to-peer. So we have to get one of our physicians to talk to a physician in the insurance companies to have this discussion about why this should get paid or why this should get approved.
Right.
And so it's a lot of, and I look at that as they put the speed bumps in your process to slow you down, because some organizations might just throw their hands up and say, okay, we didn't get paid, move on. But we can't afford that.
Right.
Because for all organizations, we've got to get paid for the work we do.
Right.
And so the reimbursement compared to the expense is where we struggle. Because as an organization, you mentioned the number of employees. So we have about 750 employees at OSF, St. Anthony's. We have to be market comparable or market competitive from pay.
Sure. Right.
So, our competition in the market are other big systems like BJC, SSM, and Mercy that, can throw money at problems.
Right. Mm-hmm.
So we have to make sure that our nurses, their pay is equivalent to any other organization. So we got to continue to watch the market and do these pay increases, which adds money to the expense side of the balance sheet, right?
And a lot of times you're dealing with potentially life or death issues. It's like nobody's going to sit and haggle about how we're going to pay for this.
Right.
You just have to give the care.
Right.
But that is and then it's a frustrating thing for the consumer as well, because they sometimes get caught in the middle of, well, I thought my insurance company would pay for it. Now they're not. I've got these huge bills racked up, and it can really cause financial issues. So it really can snowball from there.
Well, and the other kind of factor, I mean, not that we don't care about it or it's not, it doesn't hit us financially, but it does because we are here to take care of our community. So we have a higher percentage of Medicaid coming to St. Anthony's than any other hospital in our market. And then we also have what we call bad debt or charity. So a lot of patients who can't pay, and we write off their accounts.
Sure.
A lot that we give financial assistance to so that we can support them and help them pay their bills. And we help them apply for Medicaid if they're eligible. We do a lot of work to try to help the people who seek care at St. Anthony's get the care and not have that financial burden if it's unnecessary.
Right. Well, it's a fascinating position that you have, a difficult job. We could go on for a while. We've got to wrap it up here. But just to close, what advice would you give to young business professionals, maybe not even young, but just people thinking about getting into leadership or a business ownership role?
Yeah, I say immerse yourself. If you're interested in a career field, immerse yourself in it. Read the literature. In the health industry, we all have our literature. We all have agencies. So I'm a fellow in the American College of Healthcare Executives. So it's a professional society that is designed to advance our profession, but it also provides education and ongoing information. I also think that you need to get involved in your local, state, or even national agencies. Volunteer to be a part of that. I would even suggest getting on boards, do other things in your community, so you get exposed to other, even other industries, because you can find maybe some good mentors or other leaders that can help you through some of the growth that you need. Because the two that I mentor, they call me and will say, hey, I'm considering looking at this job. Then I can talk them through, say, okay, this job requires this kind of experience, this level of education, and we talk through, are you really ready to take on that job, right?
That's a great point, though, about immersing yourself, not just in the position, but in the community. There's hardly any civic organizations out there that aren't looking for people to come help out. And yes, there can be some selfish reasons for joining those. It can be about personal growth or what you're getting out of it, but at the same time, you're going to be able to give back to your community too, which I know you guys do a tremendous job of. And We appreciate everything you do in the
Yeah.
community, and thanks so much for coming on the show.
Yeah.
And great talking with you.
Yeah,
Appreciate
thank
it.
you.
Thanks.